This is Living Healthy with Your Health Potential, where we explore your options for better health. Brought to you in association with The Woman in You.
Hi, welcome to Living Healthy. I'm your host, Cheryl Worthington-Turgeon. The landscape of healthcare and insurance options are changing, and as it does, we could see more opportunities to explore holistic alternatives to medical treatment. In this episode of Living Healthy, we will talk with registered nurse Burke Lennihan, author of Your Natural Medicine Cabinet, about natural healing methods. A Harvard alumna and health expert on Dr. Oz's sharecare.com, Burke Lennihan has over 30 years' experience in natural healing. She blogs for Psychology Today and practices at the Lydian Center for Innovative Healthcare in Cambridge, Massachusetts. We talked with Burke at the Marion Institute's Connecting for Change event in New Bedford, Massachusetts. Here's what she had to say.
Actually, what I'd like to do at the very beginning is put out my vision for healthcare, which is also, I found it in this wonderful book, which I'm going to recommend. It's called A Return to Healing by Dr. Len Saputo, who's been running holistic clinics or integrative clinics in San Francisco. And he lays out this whole vision for healthcare that totally turns it upside down from what we have right now. And he says when someone has a chronic illness, let's first treat them with a healthy lifestyle. Let's get them eating healthy and exercising. And if that's not enough to fix their high blood pressure or their diabetes, then let's do completely safe, non-interventionist, energy-based medicines. And that could include acupuncture, it could include homeopathy, Reiki, the different energetic forms. And if that's not enough, then let's think about high-potency vitamins and herbs, like medicinal strength of vitamins and herbs. And if that's not enough, as a last resort, and only as a last resort, let's consider prescription drugs and surgery. And of course, that's the exact opposite of what we do now. If people have high blood pressure, or if they have high cholesterol, it actually says in the package insert for the drugs. So doctors are not supposed to prescribe the drugs until they have already tried and failed with a change of diet and with exercise, but they don't really follow that. They get them right into using the drugs. And of course, drugs have side effects. Whereas natural healing, we tend to think of as having side benefits. People, they do a holistic modality, they feel better in other ways. So anyway, let's think about this as the goal that we're working towards, but we're not there yet. And then we'll think about kind of the chinks in the wall as this is starting to crumble. And a couple of reasons why the current system is crumbling. One is simply that it's not working very well. People are getting sicker and sicker. People are put on a drug, they're told you'll be on this drug for the rest of your life. Well, clearly they're not being cured. If you're going to be on the drug for the rest of your life, it's not curing you. Whereas a lot of holistic modalities can cure chronic illnesses. The other problem is that it's getting more and more expensive. I mean, healthcare premiums are going up so much every year. It's turned into a major factor for businesses trying to control their costs, for unions in their negotiations and so forth. So the cost of healthcare is going up. And we've kind of reached this tipping point, I think, in America, where policymakers are starting to look at the natural alternatives, both because they work better, they keep people healthier. They prevent recurrence, they can actually cure, the natural modalities can, and also because they're so much less expensive. A couple of research studies that show how they can be less expensive. One example is the Canadian postal system insures its own employees. And of course, mailmen and mailwomen get a lot of back pain because they're carrying these heavy packs. Right. So they did a research study. They let people choose, are you going to go to a conventional doctor or to a naturopath who might use herbs, perhaps some chiropractic adjustment, vitamins, things like that. Maybe teach them some ergonomics, but basically a natural approach. And they found that the natural approach both worked better and also cost the government less. So now they're increasing studies like this, kind of side-by-side studies, where you take a particular health problem that people have, and you can let them choose, go to a conventional doctor or go to a more natural doctor. And pretty much every time, the natural modality is winning, both for effectiveness and also really saving on costs. And this is, I think, just starting to shift the view of employers and insurers who historically have tended to think that natural things like, let's say, chiropractor, massage, acupuncture, those are like frills. Like if we add those to our healthcare package, they're just going to add more expense. They're like a luxury that we can't afford to add. And I think that people are starting to get the message now that they're going to save on healthcare costs and help employee morale, and also reduce absenteeism. Because of course, people know if you or your child, if you get sick and you take antibiotics, you're more likely to get sick again. I mean, this is according to conventional medical studies, that antibiotics, of course, are not only destroying the offending microbe, but all the healthy bacteria in the gut, which is such an important part of our immune system. So taking antibiotics is a setup for the next time to happen. And parents know this with the kid with the ear infection, with the colds. They get on this endless treadmill of antibiotics and illness, having to stay home from work. So employers are starting to figure out it's actually in their interests to support a better approach. This is just happening. I can think of a couple of companies. Whole Foods is an obvious example. There's a YouTube video where the CEO of Whole Foods, John Mackey, explains that he said he had an employee who came to him, this woman who had diabetes. She said, I'm afraid of going blind, and I want to do a natural approach. Why doesn't our employee health insurance cover that? And he said, that's a really good question. Here we are at Whole Foods. He started to send his employees with chronic illnesses to a doctor who really specializes, Dr. John McDougall, who's such an expert, teaches them about healthy diet, herbs, vitamins, healthy lifestyle. I think he said he was saving $400 million a year in healthcare costs. It was unbelievable how much money they were saving. But more importantly, healthy employees are going to show up for work more. They're going to have more energy. They're going to be more inspired, more enthusiastic.
And as you said, they will not be experiencing side effects that they do. I mean, any drug is going to bring side effects with it.
Right.
So are there any diseases that you can think of that could not be
couldn't be treated with a natural method, let's say. Yeah, I'm going to think of the obvious example. Somebody's in a car accident, of course you're going to call. You want the ambulance to come. Sure. That's what Western medicine really excels at, is trauma care. And sometimes the person really just does need surgery. You know, there's something that has to be removed, or something that's blocking something. I learned homeopathy from an MD. He was from Belgium, where homeopathy is much better accepted and integrated than it is here. Anyway, he had treated several 100,000 people with acupuncture, homeopathy, and so forth. But he told the example of a woman who came in with intense abdominal pain, and he gave her a very good remedy. He said it would work a little bit and the pain would come back. He would give it to her stronger. It would work a little bit, the pain would come back. And finally he said, there's something wrong with this picture. It should be working. We expect with natural healing, it works, you're done, you know, the problem's over, goodbye. Yeah. But it kept coming back. He said, you really have to see your doctor. It turned out she had something called an adhesion. It's a little fibrous, like a little fibrous string wrapped around her intestines. He said for the surgeon, it was the easiest surgery he ever did. One little snip, she was better. Homeopathy could not have fixed that. Vitamins and herbs could not have fixed that. So we think of it as something that's very structural, something that's in the structure of the body. You're more likely to need surgery. I'm going to give you another example. I might have a woman call me up and say, I have fibroids. Is that something you can help with? Well, actually, I've had women with small fibroids take a homeopathic remedy and say, you know, I see some stuff coming out, and now my gynecologist says there's no more fibroids. It seems like maybe with very small ones, they can be dissolved. But if the woman says, I have a fibroid the size of a basketball, or, you know, grapefruit or whatever, you know, she's going to need surgery. But what can I do for her? I can say, here are the remedies to take before and after surgery, so you have a much better experience with the surgery. And another thing we can do is look at, why did this happen in the first place? Like, anything in that area for women a lot of times has a very strong mind-body connection. Maybe the woman wants to have babies and can't, and that's an expression. Or maybe she's, you know, when there's kind of a congestion of energy in that area, or a blockage of energy, it could be maybe the woman was sexually abused. I don't want people to think that anybody they know with fibroids had that experience. Not at all. But it's more, something happened. Like, it's not normal. It's not natural. There has to be an explanation. And if we can find the explanation, then we can remove that with homeopathy, and then she may not get fibroids again. Whereas the surgeon would say, I can't guarantee the fibroids won't come back. It's something, Western medicine is not that great at preventing a chronic situation from coming back. You know, in natural healing, we think of it as, if you can imagine a garden, you have flowers in your garden, that's your healthy body. You have weeds in the garden, that's your symptoms. if you were to come along and snip off the top of the weeds, they'd be gone temporarily, but they would grow back. Right. If you could get like a trowel or a pitchfork and dig out the root, then you're really taking care of it. And with homeopathy and herbal medicine, acupuncture, the natural forms of healing, we're trying to go to the root, the energetic root, which could be an emotional trauma. Also the root, honestly, it could be really crappy diet. I mean, it could be the person is eating a really junky diet. They don't have the nutrients that they need. Or it could be side effects of drugs, toxins. I saw one little girl, she had endometriosis. She was 17 years old, so young to have endometriosis. In her case, it was very clear. She grew up next to a W.R. Grace toxic waste dump, and she and her friends used to play on it, and every kid on the street had leukemia or she had endometriosis, some chronic illness. Anyway, it was clear there's a reason. When people get sick, there's a reason, and we need to ask why. And a lot of times people know. They'll know what we call the never well since. You know, I used to run a school of homeopathy, and Dana-Farber Cancer Institute actually sent a nurse to study homeopathy. She was the head of what's called the Bloom Resource Center, which is a great place you can go. For any kind of cancer, they'll tell you. They have books, they have videos, and so forth, what the alternatives are for your kind of cancer. So for her to learn homeopathy, she came to my school. We explained this idea, that never well since your illness, there was something that happened at the beginning. She was running a breast cancer support group. And after every school weekend, the students, these women would ask her, tell us what happened, what did you learn, what did you learn? When she told them about the never well since, they went around the room. She said every single woman knew why she had been susceptible to cancer. And they all said, my doctor wasn't interested in hearing about it. Isn't it interesting? Can you imagine how different our healthcare system would be? First of all, if we took care of emotional trauma when it happens, if we were more aware and honoring the power of emotional trauma, and we had a better mental health system. Ideally,
And are you thinking that with the emotional trauma, it would be a combination of homeopathy and other therapies, that sort of thing?
Yes. When someone comes to see me and they have suppressed anger or suppressed grief, then I would want them to be seeing a therapist at the same time, because a homeopathic remedy, in the process of releasing that, they may be re-experiencing some things. So I want them to have a therapist. Honestly, I practice in Cambridge, Mass. Everybody has a therapist already. They get a therapist before they get a homeopath, so that's not usually an issue. But what I wish in our mental health system is that therapists were trained in homeopathy, because what my clients find is that their therapy goes more quickly, they can access memories more easily, they're able to do the work better. The whole process works better with homeopathy. So if I had a choice in general, if I had to choose between homeopathy and psychotherapy, I'd say homeopathy is going to work quicker, it's going to release things quicker, it's going to help with the physical symptoms related to the emotional trauma. But in an ideal healthcare system, people would have access to both.
Right. Yeah. Speaking of that ideal healthcare system, now I loved your vision.
So what are we going to do about it?
Yeah.
Well, I mentioned there are some companies, Whole Foods, I don't know if I mentioned Safeway is also doing a great job of providing a more holistic options for its employees as part of its employee health package. There are some insurance companies now that are starting to cover more holistic things. This is a very new thing, and right now I'm not sure they've actually started marketing them yet, but I know that there are people who are looking at this. Can we have a combination of a primary care-based practice and health insurance and coverage for holistic alternatives that would actually be more cost-effective than our current insurance model? It's very much in the works right now. So those are a few things.
And if you look at other countries as compared with the U.S., where really for years homeopathy has been available, acupuncture has been available.
Herbal medicine through naturopaths,
how do those populations compare health-wise with those in the U.S.?
Well, I think the whole rest of the world is healthier than the U.S. That's an easy one. But I'm thinking about, for example, in Switzerland, the Swiss government, where homeopathy is very popular, they spent 5 years studying homeopathy compared to conventional medicine, and people are allowed to choose if they want to go to a homeopathic doctor or a conventional doctor. And they had a commission that looked at this and also looked at all the research on homeopathy. They concluded that homeopathy worked as well as conventional medicine, and it was 15% cheaper. That may not sound like a lot, But think about that cover article in Time. Do you remember that article called Bitter Pill? It was about the incredible cost of our healthcare system that said a given surgical procedure costs 5 times or 10 times as much here as in other countries. The same pill costs 10 times as much here.
Right.
In general, healthcare in Switzerland, it's about maybe 3 to 5 times more expensive here than in Switzerland. Now think about the comparison. Homeopathy is 15% cheaper than a healthcare system that costs maybe 20% of what our healthcare system costs. That means it might cost 10% here of what we're spending on drugs and surgery. So the decision makers, the policy makers are being really forced to look at the alternatives. And they are looking at other countries, and they're looking at different subsets that have a healthy lifestyle to make this kind of comparison. I'm just going to mention one other option people might look at. Apparently there are Christian groups that provide their own internal health care. I don't know if you've heard Christian insurance groups.
Mark Hyman has been involved with some of that.
Yeah. So apparently there are Christian groups that provide their own health insurance the way an employer might, but they're religion-based. And this is what I've been told. They tend to like homeopathy. They tend to provide coverage for natural healing and herbal medicine and so forth. It's something people might look into. One of my clients told me about it, and she said, you don't even have to be actively involved in the religion. You just can join this health insurance group. So I think if people look around, they're going to find more ways to do it. Another thing, people might find is that even if they have to pay out of pocket, they will save money. There was a study done, a survey, by the American Medical College of Homeopathy, and they interviewed hundreds of people who were under chronic care with a professional homeopath, and they said, how much were you spending on your diabetes, your arthritis, whatever, before you started professional homeopathic care? Now, it was all covered, but people were paying co-pays, and sometimes it's hundreds of dollars a month that they're paying for drugs, doctor visits, lab tests, versus paying out of pocket for a homeopath. People were saving more than $1,000 a year, even though they were paying all of their homeopath out of pocket, and they were only paying co-pays. The co-pays added up to more than $1,000 more. And of course, the other benefit with the drugs, the doctor will say you'll be on this for the rest of your life, and you might need more and more, like thyroid medication or whatever. The homeopath is going to say, I want to get you off this. I want to get you better. I want to get you out of here.
Right,
you know, it might take a year or two, but there's an end point. You are better. You're good to go.
Yeah.
And other things get better. This happens all the time in my practice. Someone might come in for headaches, and she comes back, and she says, well, the headaches are gone. And by the way, I forgot to tell you I have hemorrhoids, but those are better too. Or my knee pain, those are better. But here's the amazing thing. Over and over I hear people say, and my husband's being nicer to me, and my boss is being nicer to me. And I know it's something about the person and the way they hold themselves in the world and the way they approach people or interact with people, because I've heard this so much. And they'll also say things like, I sleep like a baby. My period snuck up on me. I didn't even know it was coming. My favorite one. And I got the guitar out of the closet and I started playing again. Talk about side benefits, all this like flowering of life energy that happens. And it could be, again, with a healthy diet, with vitamins, herbs, homeopathic remedies, all these side benefits.
Yeah, that's right. And it really is an upward spiral that ends up happening rather than suffering and just sort of managing day to day with medication.
Yeah. You mentioned Mark Hyman's book. It's actually, I really like Mark Hyman's books. He's written about, one about blood sugar. He's written one about metabolism, about inflammation and arthritis. He does an excellent, excellent job of telling you what healthy foods are, healthy supplements, maybe some tests you could ask your doctor to run. If people want to know where to start for chronic illness, that's where I would start with his books.
Oh, I agree. And he actually worked with a church group to find, and found that the group support just enhanced the healing of the groups that much more.
Which is like the Dean Ornish program. And Dean Ornish, of course, was a pioneer with this, where Dean Ornish would take people who had had a heart attack, typically men, they were more susceptible, but guys working really hard, working really long hours, so much stress. The men would have a heart attack, and then he would get their wives involved too, get them in a support group, and teach them healthy recipes. I think he had these guys doing a little yoga and deep breathing and going for walks and exercising and doing some support groups, a little group therapy. They probably didn't call it that, they called it stress reduction. And they were able to improve their overall cardiovascular health better than if they'd had an operation. You know, I learned this from my dad, who was a vascular surgeon, and he told me this long before it came out to the public, but you know that when somebody gets a blocked coronary artery in their heart, they put in a little stent. It's called a stent. It's like a little thing that opens up that blocked up artery.
Right.
And it involves heart surgery, and it's expensive, and it's costly for the person. I mean, in terms of time lost from work and pain and suffering. But the thing is, they clog up again. They don't actually work that well. A few years later, there's the same problem if the person doesn't change their diet. And I'm proud to say my dad, back in the 1960s, my dad was telling his patients to lose weight, start running, you know, cut back on the fat and all that. He didn't even want to do surgery until people had changed their lifestyle. But he said he was so far ahead of his time, and he said that the newer doctors, the younger doctors, all they want to do is put in stents. They don't want to talk about healthy lifestyle. So Dean Ornish really proved that with a healthy lifestyle you could get better results than with stents, and now Medicare is covering his program. So this is just one sign of things that are changing. So he was a pioneer. He did very good research. He was able to prove it. He got Medicare to cover it. And this is like the wedge, you know, this is like there are going to be more programs to come. Diabetes is going to be easy to show that with better food and with supplements and herbs, or wonderful herbs for diabetes, that you can reduce people's needs for medication and possibly even get them off it. Yeah.
Right. So that what we consider the broken healthcare system of today is actually in the process of transforming, isn't it, into something that can really help people.
You know, I want to mention something else. There's a documentary called Escape Fire. Have you seen this?
No.
I think it was put together by Andrew Weil, and people can go online. They can just search for Escape Fire. They may have to pay $10 to view it, or they may be able to download it for free. Excellent, excellent, excellent side-by-side comparison of the different ways that a certain health problem is dealt with. And it follows, for example, a young doctor who wants to talk to her diabetic patient about nutrition, and she can't get reimbursement for that. But if he develops gangrene in his foot and she amputates his foot, she can get paid for that. Right. You know, it's like it's called the incentives within our healthcare system. Doctors get paid to do more procedures and not to spend time on healthy lifestyle and so forth. And that is all changing. This procedure-based reimbursement is changing. So people will learn a lot more if they look at Escape Fire, about a vet who, by meditation, here's this guy, this soldier back from Iraq who had an amputation, I believe. He's using meditation to overcome his pain because he does not want to get addicted to painkillers, which are a really huge problem now, these addictive painkillers.
Right.
Yeah.
Right. And you had, at one point, I think in our last show, you mentioned that homeopathy is actually great for pain.
Yeah, it works really well for pain, yes. And I gave the example of the teething baby. You put the pellet in the baby's mouth and the baby just stops crying. Well, the most common remedy, chamomilla, can be used for tooth pain, for example, or for labor pain, or for a woman whose menstrual pains are so intense, she says, I feel like I'm going into labor. Chamomilla will work for that kind of really intense pain. Fantastic. So it's just an example. Wow. Yeah.
Any other natural methods that you would recommend that people explore in conjunction with homeopathy?
Sure. Well, first I think of things people can do for themselves, you know, and of course that would begin with healthy diet. My favorite suggestion for my clients, green smoothies. Get a Vitamix, get that kale, make those green smoothies. The miracle is kids like them. You're like, thank you, God, you can get kids to eat green vegetables. You throw it in there with the fruit and the frozen banana or something. So you have to eat healthy. You get your good essential fatty acids, like from fish oils. My own favorite, chia seeds, these tiny little things that you soak in water, or real favorite, coconut milk. You ever tried this? No. You soak them in coconut milk and they taste like coconut, and they make the coconut milk more thick and blobby and luscious. Yeah. So chia seeds, and then, you know, so just healthy eating in general. You want your deeply pigmented fruits and vegetables because all the natural medicinal qualities are in those pigments.
That's right.
Yeah.
The antioxidants.
Yeah. And then things for stress relief, like deep breathing, such a simple thing. But you know how when we get anxious, we tend to go like this and our chest kind of collapses, we get very shallow breath. That shows you how our mood can affect our breath, but it works the other way around. If you decide when you're anxious, I'm going to open up my chest, take a nice deep breath, you can actually change your mood. You can feel less anxious. It works for hot flashes. There's a study done on deep breathing for hot flashes.
Fantastic.
Yeah, fantastic. And you can also do visualizations. You can just imagine having a healthy body, and then you can imagine yourself going out there and exercising, because you do need to exercise, and we need to be in nature. Human beings need nature. We get energy from nature. So all of these things are self-care things. And there are, of course, other modalities. Acupuncture is wonderful. Chiropractic is wonderful. You know, there are many different professional modalities. But I'd like to start with the self-care things.
Yeah, that sounds great. So where would you suggest people start on their path in terms of finding a homeopath?
Sure. You know what I would do is I would go to I want to support the local independent health food store. The best thing is word of mouth, and ask them who's good in the area. They might have a very good homeopath, a very good naturopath who uses more herbs and so forth. You want somebody who gets good results and has good bedside manner. It's easier to find a good naturopath, and what you want to do is to find a naturopath who's been to an accredited school. They'll have ND after their name.
What prompted your interest initially?
In natural healing?
Yeah.
Oh, it's a funny story. Well, my dad's a doctor. He helped develop the Doppler ultrasound. My mom was a research biochemist, helped work for the doctor who developed the pap smear. So I grew up thinking I was going to be a doctor or a research biochemist. I got to Harvard and I read a book called Adele Davis, Let's Eat Right to Keep Fit. I said, that's it. I found out that you can cure and even prevent chronic illness with a healthy diet and supplements. I said, that's it. This is what I want to do with my life. But there were no schools. There were no schools of naturopathy or acupuncture or anything like that. So I graduated from Harvard and I opened a health food store, and my parents, God bless them, they helped out. They were, I think they were bewildered but supportive. And in my almost 20 years in the store, I found that homeopathy was just the most astonishing thing that could work so fast with such dramatic results that I said, it got to be too exhausting to run the store. I said, I want to do something more professional. I just really decided to learn homeopathy professionally, because it's such an exciting, amazing profession. You can do so much to help people with it.
It really is. Well, thank you so much for joining us
thanks
today.
for having me.
It's been
fun.
Just fascinating.
Yeah.
For more information on Burke Lennihan, you can visit her website at yournaturalmedicinecabinet.com. For more information on the Marian Institute, you can visit them on the web at marianinstitute.org. Thank you for joining us today. I'm your host, Cheryl Worthington Turgeon. See you next time on Living Healthy.